More, we're joined now by Dr. Andre Campbell from UCSF. Dr. Campbell, always good to have you on. Today, the big story here in the Bay Area, health officers in 3 counties, San Francisco, Santa Clara, and Contra Costa, urging employers to consider requiring their employees be vaccinated. How big a difference do you think this can make in slowing the spread of the Delta variant?
Well, Alex, thank you for having me on today. The first thing is that as was said before, we're in a new phase of this pandemic. And I think having mandates like this is something that can be done. You probably heard already in Houston Methodist, they mandated it. And if you didn't take it, they ended up letting you go. I think it's a reasonable, safe thing to ensure that everybody who's taking care of patients are fully vaccinated. And I think it's safe, it's reasonable, and it's the cautious thing to do for these health officials to make this announcement.
How about this idea, the news this week that a group of 500 bars in the city of San Francisco are considering requiring proof of vaccination to get inside their establishments? You may have restaurants, other business owners get on board with this idea. Do you think that would be enough of an incentive to raise vaccination rates if people didn't have the opportunity to go out and enjoy themselves in places like bars and restaurants?
Well, I think anything you do to incentivize the fact that you could take the vaccine is a good idea, so that if you want to get in the bar, you should never show a vaccine identification. Now, we already have vaccine passports to get around the world. You go to South America, you go to Africa, wherever you're going, you get the shot. So I think having something to do it. Now, the state of California actually has an easy way that you can actually upload things, and you can put it on your phone, take a picture, and get your QR code, so you can verify that you have a vaccination. So I think it's important because we're in a new phase with this Delta variant. It is very infectious. Instead of what it was before, where a couple people get infected in the family, entire families are getting infected because of the Delta variant. So anything you can do to get more vaccines in arms is something we have to do.
All right, we talk a lot about how the fact that most people who are hospitalized right now with COVID, 95% of people, in fact, in California, are unvaccinated here. And I want to point your attention here, Dr. Campbell, to a doctor in Alabama who has a Facebook post that's gone viral recently. Dr. Brittany Kobia is her name. And she wrote in part here, after dealing with patients in her hospital who are dying from COVID-19 and who are unvaccinated, she wrote, quote, "One of the last things they do before they're intubated is beg me for the vaccine. I hold their hand and tell them that I'm sorry, but it's too late." Obviously, you think about those situations with patients dying from COVID-19. It's heartbreaking to think about, but it obviously raises the question, Dr. Campbell, how do we reach those people and convince them to get the shot before it's too late?
Well, first of all, I saw that story, and I have to say it's heartbreaking to see that, because I've seen patients get sick and die over many years of my practice at San Francisco General Hospital. So that's heartbreaking. But I think that we really have to go into a really ground game to make sure we get to every single patient we can, to ensure that we talk to them about their fears, we educate them, and then we get rid of this misinformation. These vaccines are safe, they work, and they've been distributed readily. Over 339 million people have been, at least have one vaccine. 156 million people have had both, so we're about 55% fully vaccinated, but we need to get that number up. So anything we can do to improve the amount of vaccinations people get, because these vaccines are safe. Misinformation has to stop, right? Nobody has died from this. These are safe things for people, and it's effective. You said over 90% of people, it's effective against the Delta variant, and that is this thing that is now, the Delta variant is changing the nature of the infection. So it's important we get as many vaccines in the arms as possible, as quickly as possible.
Dr. Campbell, before we let you go here, I know that you are aware that nearly all Bay Area counties right now at this point have recommendations for everyone, vaccinated or unvaccinated, to wear masks when they're indoors. Do you think that needs to move one step further, where we go back to a point where counties are mandating indoor mask wearing?
I think, given the fact that this variant is so infectious, I think the safe and prudent to do is to have a masking mandate inside. I know it's controversial, it's difficult, but we have to get kids back in school. Got to make sure people wear masks inside so that we don't really spread the infection. So it's not something that's hard to do. It works. it's scientifically proven that it can reduce the spread. We have to reduce the spread, and if inside masking works, which it does, I would do it. So I support doing indoor masking right now because of how the pandemic has changed.
And because of the Delta variant spreading so rapidly right now. Always appreciate you taking the time, Dr. Andre Campbell from UCSF. Thanks for doing it.
Thank you for having me.
Sure. And for the latest developments on COVID cases,